joining the call today. We have a very exciting program today. We are really fortunate to have you all on the call with us and be part of Health ESU moving forward. There's a lot of, if you haven't noticed it already, there's a lot of energy in the space today. There's a lot of buzz around the marketplace about telehealth, and Health ESU is at the forefront of those companies. We feel we have by far the best reputation in the industry, and we've done a lot to really use that service and use the overall technology platform that we have, the tools that we have, the marketing. We're going to share a lot of that with you today. I'm going to go over an overview of the service itself, but then we're going to really dig into, we have our Director of Client Success here that's going to kind of dig in and really tell you behind the scenes how we really engage your employees, your customer base, and help Health ESU make the most out of that for them. So to get started, I'd like to kind of do an overview of Health ESU. My name is Eric Kronegold, Executive Vice President with Health ESU. We're going to open it up. We're going to go through an overview. We'll talk about how we engage your employees. We'll kind of wrap up the call, but important, if you stick around to the end of the call, you're going to have to listen to myself and Dan for a little bit, but we're going to give an iWatch away at the end of this call to everyone who's still on the call. We're just going to do a random draw. We appreciate you joining today, but let's get the call started. So Health ESU, who is Health ESU, what do we do, and how do we make a difference in the world of healthcare today? Health ESU, we do not like to just view ourselves as a telehealth company. We like to view ourselves as a member engagement or an employee engagement company and a claims redirection company, because that's really how we're going to make an impact on your clients' success and make an impact on the overall healthcare and how people access healthcare today. So let's take a look at a little bit of history. If you look at some of the technology platforms and the different types of services that are available today, think about TiVo, and think about how TiVo really shaped the way that we view television. You don't have to now look at television when the programs are on. You can view a show whenever you want, a week after, a month after. You can skip through commercials. You can view TV when you want to on your time was convenient for you. Google, what did Google do for information? It put it at the palm of your fingertips. You didn't have to now go into a library or read information from magazines or textbooks. You can go at the palm of your hand on a laptop, get information quickly, shift information. It really changed the way that we interact with the world. Uber, no more trying to call a taxi, wait around, flag one down on the street when one's available. You can place shift now. You can get anywhere quickly and efficiently with Uber and the app and the way that they've actually solidified that technology and put it all in the palm of your hand. Health ESU has done the same thing. We're shifting health. We're shifting the way that you interact with your physicians, with your prescriptions, with procedures, with everything that has to do with your medical insurance and accessing doctors quickly, and I'm going to share with you how we do that. So Health ESU, we interact with your clients the same way that your clients are available to access technology. So if they have an old rotary dial-up phone, they can still access our service. But if you get into, I just read a statistic that 65% of all adults in the United States now have smartphones. That lends straight into our technology. So smartwatches, kind of like the iPhone watch that we're going to give away, smartphones, tablets, computers, smart TVs, it doesn't matter. Now that you're in the technology world, we're taking you to an exponential place where you can actually access that type of service. So how do we do this? The marquee part of what we do is we've centralized healthcare options all in the palm of your hand. So kind of the elevator pitch or the marquee part of what we do is our telehealth service. So you can call up our service 24 hours a day, 7 days a week, and a licensed doctor, we guarantee, will call you back within 1 hour. Our average response time right now, believe it or not, is 9 minutes when a doctor actually calls you back. But in 95% of the cases, that doctor is able to diagnose over the telephone, and if necessary, they'll phone in a prescription at any pharmacy you like. It's an amazing service, but what we found is that it's a powerful service, but if nobody knows they have it or they're not constantly reminded that they have it, they're going to forget about it and they're not going to use it, and the power of that service is greatly marginalized or minimalized. So how do we constantly remind them? We have a variety of techniques that we do that, but one of the ways is that we offer a vast variety of other content to go along with it. So we offer prescription savings. We offer health management content. You can locate providers. You can shop and price procedures from our platform. You can even manage your own medical deductibles, and I'll show you how you do that in a little bit as well too. But one of the most powerful statistics that I love to start off with is that if you didn't know this, the AMA, the Wellness Council of America, they estimate that over 70% of the times that we go in to see a doctor in person, whether it's urgent care, emergency room, or primary care, over 70% of those visits could be handled safely and effectively over the telephone. That's where we come in. So HealthiestYou is meeting those types of conditions that are very common and treatable over the telephone. So if you look at the screen here, these are the top 9 reasons, according to the AMA, why we actually go in person to see a doctor in the emergency room. These almost identically mirror the type of conditions and the top conditions that our doctors treat over the telephone on a daily basis. So you can see how you can get to a vast majority of those conditions quickly and efficiently over the telephone, simply using the HealthiestYou service. So one of the things that we were passionate about here at HealthiestYou is educating employees. We want to be able to redirect those claims, but we got to kind of break those employees' the habit of that they've been trained since they've been little children. We've all been trained to, if you're sick, go into a primary care office, see your doctor. It's going to average about $125. You're going to be subjected to patients with germs. There's travel time, so now you have to drive back and forth to the doctor's office. The claim will hit the major medical and against your plan. And for a primary care office, the times or the availability are limited, typically 9 to 5, Monday through Friday. We were trained, if the doctors weren't, the primary wasn't available, go to urgent care. Now it's $175. Many of the same limitations apply, and if that wasn't available, we're trained to go in and go into the emergency room. $1,200 on average. Many of the same limitations, very expensive, not convenient at all. So what we do is we'll show you a number of different techniques on how we educate and how we build into the benefit plan design to start with HealthiestYou. Put us front and center. Have us be that gatekeeper, if you will, to access doctors. So we have 0 consultation fees to consult and prescribe with our physicians. You're not subjected to germs. There's no travel time. Now you're not going back and forth. And the claim will not hit to the major medical. And it's available 24 hours a day, 7 days a week. So a few main questions are going to come up. The biggest question, there's about 2 or 3 of them. Who are these doctors? Are they doctors in a call center overseas? No, they're doctors that are all U.S.-based licensed or board-certified physicians. They average about 14 years experience, and there's all types of doctors on our network. We have a lot of primary care doctors, but we also have a lot of emergency room doctors and specialists like pediatricians and different specialists on the networks based on availability. These doctors are highly trained in telehealth. We're proud to say we have by far the largest telehealth network in the country. Many of our competitors, and you can really count the main ones on one hand, have anywhere from 300 to 700 doctors on their network nationwide. We have almost 2,400 on our network. It's because we give them so many calls, and I'll share some of those statistics with you in a bit as well too. Services available. This slide is a little bit dated. Actually, we're back live in Idaho. Services actually available in 49 states. The only state that we cannot consult and prescribe in right now is Arkansas, and we're trying to work with that medical board to get that corrected. So how does one of the things that you're all on this phone call today, you're all professionals. We are distribution partners, and one thing that's important to know about HealthiestYou is that we do not go direct to end clients. We do not go direct to consumers. We only go through benefit consultants, carrier partners, and brokers like yourselves on the telephone today. And we know that coming along with that relationship is a lot of trust. You have clients that have been your clients for years. You've worked hard to get them, and put in HealthiestYou and is asking them to take a leap of faith and put a trust in a service that you may not be familiar with. Well, I can tell you that our consultants and brokers that have used HealthiestYou with their clients we will make you look good, and we understand that relationship that you have with your client is important, and we take that very seriously. So one of the things that we want to do is we want to make sure that that member has a phenomenal experience for a number of reasons. Number one, to make you look good. But number two, to have that member be happy, have them use it again, and have them tell their employer about it, their fellow employees, their family members. to use it, and the word spreads like wildfire. And I'll show you what happens with some of the statistics in a second. But I want to walk through what a call is like and how it is actually handled. So the first time you're going to call Health ESU, you can either call, you can go online, or you can actually use our new smartphone app to input your medical information. So kind of like going into a doctor's office for the first time, put in your name, your age, height, weight, drug allergies, past surgeries. All the same information is stored in a HIPAA-compliant portal that each member gets. The triage specialist will ask why you're calling in. They'll go through the conditions that you're calling about, the symptoms, and then they'll schedule a call with the appropriate doctor. Prior to calling the patient back, the doctor will review that patient's history in their portal. If a prescription needs to be sent in, they'll send it via eScript. So this can be sent in to any pharmacy like. It doesn't matter. It could be a pharmacy by your house. It could be one by work. If you're traveling, they'll pull up a Google map search and they'll find a pharmacy that's convenient and located right where you are. Once the call is done, the doctor will update the notes, and then the consultation notes will actually be stored in the portal as well too. We'll actually then get a follow-up call to make sure that patient's all right, that service was okay, and we'll ask them a few survey questions to rank that doctor, and then really ask them, what would you have done? Would you have gone to emergency room? Would you have gone to primary care? Would you have gone to the ER or urgent care? Or would you have done nothing at all? And we'll actually report those back in the form of a utilization report to the carrier. So a few statistics, excuse me. 97% consumer satisfaction. People love it. They love the service. 94% of the medical issues were actually resolved. Like I mentioned before, believe it or not, the average callback time is only 9 minutes when a doctor calls you back. The last few times I've used it for my family, I've gotten a call back in 1 or 2 minutes. The average duration of the call is 13 minutes. It's important to know because our doctors are very thorough. They're trained in the art of diagnosis over the phone, so they have to be thorough, and they come off very nurturing and very knowledgeable. This is important. Client retention. We are at 95% client retention. That's because when people use the service, they love it, they want to keep it, and they don't want to get rid of it. So for year after year, we have clients being retained. And as I mentioned before, our products, the majority of our products are zero consultation fee. So that means that when somebody wants to speak to our doctors, get a consultation, get a diagnosis, get a prescription, they're coming out of pocket $0. And I'm going to share with you how that can be powerful in terms of a benefit plan design in a second. So this is where it gets really different. I'm going to ask you today if you have any history with telehealth or you have any knowledge of telehealth, kind of forget what you know about it, because the industry standard and kind of the operating procedure in the industry today is our competitors are not built to drive utilization. They are built to drive membership, and they could really care less about utilization. They may tell you the old adage of be careful what you pay get because you get what you pay for a lot of times. It's true with our competition. They are built to be a low per employee per month fee, but with that, if you're only paying a few dollars a month for a low fee, you're not going to get any support. They've got to pay commissions out of that. They have to bill and invoice clients. They have to back up the invoicing of those clients. They have to do all these different types of functionalities to make a successful business. But the one thing they didn't leave any money for was marketing and support and working with that client to really drive utilization. And quite frankly, they don't want to drive utilization because that's not their model. So typically, the way it works in the industry is you're going to get a low PEPM. There's typically a consultation fee built in. So anywhere from $20, $30, even $40 every time they pick up the phone to talk to a doctor. And then they're going to mail out an ID card to you, and that's pretty much the last you're going to hear from that telehealth provider. It falls on you as a broker or consultant. It falls on the HR director from that company to educate the employees, to constantly remind them that they have the service, and most brokers and HR directors are not equipped to do that. Well, we are, and that's what we do. So where our competitors will mail out an ID card, and then that's the last you'll hear of them. Because of that, our competitors on average, and we can show you, we actually have published reports, we have press releases that actually back up these numbers, but our competitors on average, on their entire block of business, they're at 2% utilization. So let's break that down in the real world. So if you had a 100 life group, it means that only 2 of those employees per year are actually using the service with our competitors. And we saw a huge flaw in that logic when we started HealthySU years ago. We really wanted to change that philosophy and change the industry and make a difference. And because of all the different things that we do, the marketing techniques, the constant education, all the different things we're about to show you here, in 2014 alone, on our entire block of business at HealthySU, we were at 42% utilization. And believe it or not, this year we're actually tracking to more like 48%. So it's crazy, 20 times the amount of how we get there. But I'm going to tell you how we get there because we have a very concise strategy. We have a passionate team, and I'm about to introduce to you now our Director of Client Success, Dan Levan, is going to talk to you about how we work with your company and how we take you to that next level.
Perfect. Thank you, Eric. And everyone, this is Dan Levan with the Client Success team. And what Eric kind of alluded to is, it's a behavior change at the end of the day. If your client with another partner, right, or another telehealth product, they get one membership card, they'll forget about it, right? They're not going to change that behavior and start with HealthySU or start with that telehealth product if they're feeling sick, right? Why would you use it for the first time if there's a consult fee incorporated with it? So we have seen this, and we have gone into our marketing strategy, and we do drip marketing, we do campaigns. We work with the group admin on a daily basis to educate these members because we want them to use it, and as Eric kind of pointed out with those retention numbers, as our groups use it, they stay on. They love the benefits. They don't want to get rid of it, right? I had a call with a group admin yesterday. They're renewing, and they actually changed their plan so they could keep HealthySU. The employees didn't want it to go, right? It's very important. But as we see here at our engagement pulse, this is what our client success team does on a daily basis. We're continuously, proactively reaching out to these group admins, educating, sending emails. When the group gets implemented, they actually get a member card. They get a fulfillment kit. So we actually send break room posters, flyers. Then we do custom digital marketing pieces as well. Quarterly, we're going to review that group, see what their utilization is, right? See if we need to do something different, if we need to do custom marketing, whatever it may be. As we know and as you know too, not every group's the same, right? Some might need certain marketing and some might need other marketing. We have 2 groups in Las Vegas, about 20 miles apart from each other, and they have totally different marketing from one another. One of them has a custom digital piece in their bathroom that they call the Whiz on a monitor, and it does a HealthySU loop every 5 minutes, while the other one, they don't have an office really. There's no lobby, there's no waiting room, so we do custom emails, marketing pieces, continuously reaching out to that member. Hey, germ season's upon us. We have a payroll stuffer going out to our groups next week. Germs, you're right? It's back to school season, germ season. We're about to get into a really big sick season of the year where utilization increases dramatically. So we're continuously reaching out. I really like this engagement pulse. And what I want you to imagine is a flat line, right? That's what our competitors, that's where that 2% comes from. Since our engagement pulse, the heart's always beating, we get that 42%. So just think about how we engage our employees and really drive that behavior change at the end of the day. Here's going to be that fulfillment kit. We have our smartphone app that Eric will go into here. But we really want to market to the member at the end of the day and get everything back to the spouse and dependent at home. Here's some utilization reports. And these are actually going to be 2 companies, 2 different sizes. So as we look at the left one, this is going to be 6 months worth of data for 2015. And they're using it, pretty substantially. We can see that this is a 58 life group, and year to date they've had almost 30 consults. So pretty substantial. As we see here on the bottom, you can see the diagnosis breakdown. So as we look at that breakdown, acute bronchitis, sinusitis, UTI, and so on, the average cost for those face-to-face visits is going to be roughly $500. So just think about the savings that these groups are getting by starting with HealthySU to handle those 70 to 80% issues over the phone. as we look at the airline company on the right-hand side, you know, their increased utilization year over year. We project them to be about 50% this year. And you can see the breakdown as well. You know, these members are getting their prescriptions issued over the phone. Our top prescription last month was actually amoxicillin, followed by Z-Pak. So we'll go to the next one. Really getting that proactive consumer engagement. As I mentioned, we do emails. The next one's going to be our payroll stuffer with, not allergy season, but back to school, germ season. We have flu season upon us, and the holiday season, right? We want our members to start with HealthySU and call, not have to leave work. It's going to be kind of a softer ROI there, right? We want our employees to stay at work and be healthy, and with HealthySU, they could do both. 51% of our calls are done during the traditional work hours from 9 to 5, Monday through Friday. Here's more consumer engagement. We're going to start sending out more physical pieces as well, really try to drive that behavior and get that information back to the spouse and dependents at home. We've seen sometimes, you know, during open enrollment, there's a lot thrown at these employees and they might forget some things when they're, you know, going back home. So I'll go ahead and turn it back over to Eric here. And if you have any questions regarding engagement for your employees, please feel free to reach out to us at clientsuccess@healthysu.com. We love to do custom webinars for your groups and even onboarding your groups. If you have new opportunities coming in with us, here comes the busy season, right? Let us help you, right? Let us help you onboard your clients in a great fashion to make sure they have a successful plan year with HealthySU. So here's Eric Kronegold, and thank you everyone for attending the webinar, and we will present that iWatch at the end.
Thank you, Dan. Hopefully you can see that Dan's one of our team members that will take care of your clients, will be assigned to your clients, that will work with them on a daily basis to really drive utilization. They're knowledgeable, they're passionate, they have a system in place that this is not a shotgun approach, this is not, hey, let's try something that might work. This is a tried and true test of how to really get employees to engage. And like Dan had mentioned earlier, every company is different, so we recognize that and we'll work with them in different ways. You know, I want to talk back to the 2% of our competitors versus 42% utilization. It's important to know that that was actually before the launch of our new app that I'm about to show you here. This app is amazing. It's a game changer. It's available on the App Store and download. It's available on Android, on Google Play. But this is pretty much everything that has to do with your insurance, with your doctor network, with prescriptions, procedures, all right in the palm of your hand. You're actually going to you're going to download the app, you're going to put in the information about yourself, about your spouse, about your dependents. You'll actually then put in your actual carrier. We have now over 170 different carriers built in to the plan. You'll actually put in your member ID, and that's where it starts to get really cool, because that's where it actually picks up all that information. It reads the information from the carrier, from the plan, based on your actual provider network in your plan, and it will pick up the in-network providers. It will pick up your copays. It'll pick up your deductibles, and it'll report that information right back to you. So it's all done right from downloading the app. You're going to, the first thing it'll do, it'll actually view your actual in-network and out-of-network deductibles based on your year-to-date. So it'll actually show you where you are spent year-to-date and how much is remaining on the individual and the family coverage. Pretty cool feature. This is where it gets very, very cool. So if we have geofencing built into our app. And if you're not familiar with geofencing, companies like Starbucks have used it in the past, where let's say you have the Starbucks app downloaded on your phone, and you walk by, let's say you're in San Francisco, and you're walking downtown, and you walk by a Starbucks. The geofencing in that phone will actually pick up and sense that you're close to that store. And if, for example, with Starbucks, they text you a coupon for, say, 10% off to come walk into that Starbucks that you just walked by for some coffee. Well, we've taken that same technology, and our technical team, our team here is amazing. It's all the things we're showing you here are built in-house. The app that is done in-house. Our technical team is amazing. And what they've done is they've actually taken that same technology and built in geofencing into our app. So now let's put that into real-world applications with HealthySU. If an employee has our app downloaded and they walk into an urgent care facility, for example, they're going to get a buzz on their phone. It's going to remind them. It's going to be a benefit reminder. It'll say, hey, it looks like you walked into urgent care. Did you know that Healthy as You can most likely take care of this for you free of charge? You'd like to connect with a doctor now. We educate that employee at the time of need. We try to get them to save money. We try to keep that plan off of their major medical, but we try to remind that employee that they have the benefit. We do the same thing with prescriptions. So we do geofencing for pharmacies. So let's say one of your employees or clients walk into a pharmacy, they're going to get a benefit reminder. It'll pop up, say, hey, it looks like you walked into a pharmacy. Would you like to check prices at over 100,000 pharmacies around? It's all cash-based prices. So what we found is that we actually will save employees up to 85% on medications, but the most important thing is we'll actually beat copays 70% of the time. So 7 out of 10 times we're actually beating the copay and saving that employee money and keeping that off the claim from a major medical. So it's a win-win-win across the board, but it just comes about, it's about education, and it's about letting that employee know and that member know that they have the service. Obviously, you can connect to a doctor. So right through the app, you can confirm a phone number, connect to a doctor immediately with our telehealth service. But now you can also look at, if you can't get your issue resolved with Healthy as You from our telehealth network, you can now get into your provider's network and look at actually in-network physicians. You can drill this out. You can look at, you can drill out on the radius, 5, 50 miles, however you want it. You can look in-network and out-of-network. You can type in male or female physician. You can do whatever you want to look up, doctor-wise, specialists, dentists, eye doctors. It doesn't matter. You can find them easily. So now when you find that doctor, you can actually drill in and look at the star ranking. So kind of similar to Yelp, if you will. These are actual reviews from other patients that have reviewed those doctors on a star ranking. So now you can know what kind of reputation or history that doctor has with other patients. You can drill down in and look at information on that physician of specialties, languages spoken, where they went to school. There's all kinds of information that are readily available right at the palm of your hand. The other thing that it can do is actually picks up a radar screen, and this is very, very cool. The radar, as you move around, the radar will follow you, and you'll pick up the actual type of doctors, pharmacies, urgent cares. You can actually look up veterinarians in there as well too, and you can drill in to really get into kind of specialists that you want to locate that doctor quickly and effectively through our new radar and our new app on the phone. And finally, what the system will do is it'll actually let you price out procedures. So gone are the days of a doctor says you need an MRI and you just happen to go into whatever facility is available. Now you can be a good consumer. We educate our members how to actually look up pricing in the area, find out what that average price, what the high price, what the low price, find out what your portion is going to be based on your deductible and your copay. So pretty amazing service. It's all done right through the palm of your hands on our app. A couple of case studies. This is a 146 life group that they had one of our competitors in there for 2 years prior to that. They had very little pull-through or utilization with their prior telehealth company. When Healthy as You came into there, we blew it up. We actually reported a change of redirection of claims of primary care and urgent care. So we actually were able to, the first year we went in there, we were able to redirect over 36% of all their primary care, urgent care, and emergency room visits, keep them off the claim. What that did was we actually saved this particular client almost $31,000 in claim savings. And more importantly, and just as important, we actually were able to show over 2 fewer paid time off days per employee per year, which is an incredible jump. This is a 2,200 life case that this is an amazing story, because all they did was kind of reshift the plan around. So they redesigned the benefit plan and raised the copay a little bit, raised the deductible both on the individual and the family basis. But we were actually able to redirect 37% of their urgent care spend, their utilization on this particular group, and this was a tough one because they have about 70 different locations around the country, but we were able to get 44% utilization. And the powerful part about it was that we actually saved 9% off the overall benefit plan design. So not only did we save money off of the plan design that paid for Health ESU and saved them money, but we were able to drive 44% utilization and redirect those claims and keep them off of the major medical. So today I'd like you to, if you can take away only one slide and one concept, pay attention to this slide here. So this is what our most successful brokers and consultants around the country are using and how they're using Health ESU. If Health ESU can handle over 70% of all the times we go in to see a doctor, whether it's the emergency room, urgent care, or primary care, you can access our physician network 24 hours a day. There are no consultation fees. I already showed you how you can sync up with your health plan and search providers, and you can save prescriptions up to 85%. Start with Health ESU. Put us front and center of the benefit plan design. Don't put us at the bottom as an ancillary product. Don't put us at page 6 of the benefit plan design. That does nobody any good. We want to be that gatekeeper. We're not afraid to be the front line of defense where you want employees to start with. If you're zero consultation fees, they're at no risk to call us and try it. So if you do that, and now you can build a major medical plan around it, so whether you're taking an HMO or a PPO, you can either raise copays or eliminate them altogether. You can raise deductibles. This is a perfect fit for HSAs or self-funded. The whole goal is that you're trying to save enough money on the major medical premiums to not only pay for Health ESU, but also pay for some supplemental products as well. So maybe gap, critical care, accident, cancer, maybe some ancillary like dental or vision, or even life or disability. So our consultants who are doing this are not only saving enough money on the major medical to pay for Health ESU and pay for some ancillary or supplemental products, but go back to that employer on renewal at either no increase or maybe even a decrease upon renewal. It's a powerful strategy. So it's a win-win-win situation. The employer is happy because they're not coming out of pocket anymore for benefits, or actually providing them more benefits, so they are happy. The employee, all the employees that we've surveyed and that have done this strategy, they don't see this as a takeaway. So they don't see it as, well, you're raising my copays or your deductible, because now you're giving them Health ESU. And now you're also maybe giving them some supplementary or ancillary products as well too. So the employee sees it as a win. And our consultants who are doing this, we're seeing many of them make double the first year commission. So now not only are you making commission off of major medical, yes, we pay you commission at Health ESU, so you're going to make commission from Health ESU, but you'll also make commission from some of the other supplemental or ancillary products as well too. So it's a win-win-win situation all the way across the board. This is a perfect fit. You know, I get asked all the time, well, Eric, who do you think, what's the best group, or who's the best, what's the demographic for your service? And you know, the real answer is it's for everybody. We have all kinds of groups, hundreds of thousands of lives, thousands of groups that are fully insured. We have self-insured. This is a no-brainer for the ACA for the metallic plans, where you can just bundle this right alongside of them. This is a great fit for MECs and limited med products, payers, third-party administrators, associations. We even go out to individuals as well too, and online administrators. So it's just an amazing way to get in front of any of those services. So here's the easiest part about the whole thing is the pricing. So we were the first in the industry to come up with the composite rate with zero consultation fees. So very, very simple. This is employer-paid pricing. So 2 to 99 lives, we're at a $9 composite rate. This is per employee, but this covers the entire family. So this could be have their spouse and all their dependents added on, and it's only $9 a month. But the most powerful part about this is that there's zero consultation fees built into this pricing. So they can call as much as they like. They're never going to be charged another penny. There's no hidden fees. There's no boarding fees. There's no setup fees. The price is what the price is. If you get into larger groups, 100 plus, we're at $8, 250 plus, we're at $7, 500 plus, we're at $6. And if you get into groups over 1,000, we've been very successful in this space. We'll sharpen our pencil and we'll look at each group individually and look at underwrite those groups separately and come up with a price that will work for both sides. This is employer paid pricing, so we're going to list bill that employer. We can We're going to invoice them so they can cut us hard checks. We can set them up on ACH, or they can pay via credit card. And employees can contribute to this if they like. So we're going to list bill that employer. They can have the employee contribute a portion of that, and they can payroll deduct accordingly. If an employer says, no, I don't want to pay for any of this, but can you offer this at open enrollment? That's where our voluntary rates kick in. So we're at $11 for an individual, $15 for a family. We can still list bill that employer. They can payroll deduct their employees, or we can, through our partner portal, you can actually sign up individuals where they can pay with their credit card and get our service where you get the commission as well too. So how do you get started? A few different things. So number one, I highly recommend go to our partner portal, go to healthiestu.com, go to the upper right-hand corner. I'll show you that in a second. Register for the partner portal. It's free. All the tools are in there. You can actually then get our service at a 30% discount for yourself and for your family. And then really, what I'd like to really stress today is use our broker support team. My team here is very knowledgeable in what we do. We are here to help you too. Like I mentioned, we don't go direct to clients. We only work through you, so we work in conjunction with you. But we can't expect you to be an expert. Many of you on the phone today are brokers and consultants, and you may represent hundreds of products or multiple carriers. You can't be expected to know it all. So use us. Let us help you put together proposals. Let us even present to those groups for you. And we have right now we have over a 90% close ratio when we're actually brought in tandem to actually help with those groups. So use us, help reduce claims. If you go to healthiestu.com, this is what it's going to look like here. All the information, there's demos on here. There's all at the bottom of the screen. It's a really cool interactive portion for the phone where you can kind of test out the radar. You can drag and see what will happen if you walk into an urgent care facility. Pretty cool website, interactive. But what I wanted to show you is if you go to the upper right-hand corner here under Access, click on Partner Portal. That's for our partner support. You'll register here, put in your information, and then it's going to log you in, and this is going to be your dashboard. So it'll show you can actually get digitally contracted right online here. Hit the Request Contract. You can enroll now. Then you can actually go in and put in your information to register yourself and your family for the service. Is this for, like I mentioned, you get a 30% discount. So is this for yourself or is this for your family? And you're going to get that discount show right up, and you can put in your credit card information and get the service right off the bat. But all the other things are built into here. There's a proposal system built in where you can actually build a wonderful proposal. It'll show the decision maker's name. It'll show the name of the company, all of your information here, even a personal note. But embedded right into the proposal are a video or a quick video that's about 3 or 4 minutes long that talks about the service, shows them the summary of how much it would cost the employees, and then they can actually go accept that proposal right there on the spot. There is an ROI calculator built into here. We don't, for time's sake, I won't go into that, but if you click on the folders tab, there's all different types of things. So the PowerPoint presentation I just showed you, the benefit plan design, case studies, overview flyers, pricing, everything is all there. All the enrollment forms are there for you and for your support. The census, the group application, it's very, very easy to submit a group. It's simply a group application, a very simple census, and then the first month's premium check to get that group going. But one of the important things I want to show you too is once you actually register for the partner portal, you're going to get your own landing page. So it'll have your name, the name of your company, and then it'll talk to you about how we can help their employees, and that's for employer groups. You're also going to get an individual enrollment site. So if you do individuals, you can actually offer this to them. So for less than $1 a day, they can have 24/7 access to doctors, but then they can actually go enroll now. So they can put in their name, their information, is this for them or for their family, and then they go in and put their credit card information in. They get the fulfillment in the mail, you get the commission and the credit for that group. So this is Healthy as You. I highly recommend that you, like I mentioned, you use us, you call us for questions, you get us to help you with proposals. We can help you present to groups and really take your business to the next level. I have, for the call is very large today. I would try to open up for questions, but it's going to be just about impossible. So I recommend get with your Health ESU sales representative or call in. If you don't have a sales representative, one will be assigned to you once you register for the partner portal, and we'll take you and we'll be a partner with you. Jump on the train. The train is not just sitting in the station. The train's left the station, so we have room for you. I think you'll love it, and we look forward to moving forward in the future. So I'm going to go through. We've got everyone's name in a drawing. I know a lot of you stuck around for the iWatch, so I'm going to reach in the bag here, pick out a name, and the winner looks like Don Albrecht. So congratulations, Don. We'll be in touch with you on how to get your iWatch, but we look forward to working with all of you. We try to make it have a little bit of fun on the call today. We try to have fun with the company. You'll notice in a lot of our marketing, our campaigns, we are cutting edge. We like to make it have fun, but we're professional, but we'll really help you make you look good. So thanks for joining the call today. We look forward to you working with Health ESU. Thank you, and have a great rest of the week.